Joining me now to discuss what's happening with the COVID-19 pandemic and its impact on all of us is Dr. Anthony Fauci. And of course, we all know him as being America's top infectious disease specialist and expert over at the National Institutes of Health, as well as being a member of the President's Coronavirus Task Force. Dr. Fauci, good of you to join us today. There's a lot going on. I want to start with your concerns about where we stand in our war against COVID. Let's start right there.
Well, where we stand is that we have a situation where there are a considerable number of people who are eligible to be vaccinated who are not getting vaccinated. This is turning into a pandemic among unvaccinated individuals. The vaccines work really quite well, even against the very troublesome Delta variant, which, as many people are realizing now, transmits much more readily from person to person than the original prototype viruses, such as the Alpha variant that we've dealt with before. The one thing that is held strong is that the vaccine protects very well against the Delta, particularly against severe disease leading to hospitalization and death. However, we are seeing an upsurge in infections in virtually all states, much more pronounced in certain states, which correlates with states that have a very low level of vaccination. For example, states where 40% or less of the population is vaccinated. We're having about 40% of all the new infections are confined to about 5 states. 22% of it is in Florida. So we have areas that have a low vaccination level that are bearing a major burden of the infections. That is unfortunate because all of these things are entirely avoidable if people would just get vaccinated. So it's an unusual situation we're facing. We're having upticks in infections, which lead to upticks in hospitalizations and which ultimately lead to upticks in deaths, even though we have vaccines that are really very, very effective.
Let me ask you, a lot of this is due to vaccine hesitancy. We've been reporting on it. Of course, you've talked about it. The former Surgeon General of the United States, Dr. Jerome Adams, in fact, tweeted today. He stated this: cases are bad as last summer despite 3 vaccines, testing worse than last summer, confused messaging on masks and boosters, no FDA licensure on vaccines. Is that part of the problem, the fact that the FDA has not approved these vaccines, although they're authorized for emergency use?
Well, it depends on how you frame being a problem. If it's a problem that is deliberately made, that's one story. The FDA has a certain amount of process they must go through, predominantly for safety reasons, when you're dealing with the long-term look at things, that it takes a while to get a full biological license application. Having said that, there is a bit of truth in many respects to what former Surgeon General Jerome Adams saying, that if we had a full approval of the vaccines, that would incentivize a number of people. I don't know what exact percentage, but certainly a lot more people would feel more comfortable. In some respects, that is really a complicated issue because we know that these vaccines are highly, highly effective, and we know that they are quite safe. So even though technically we don't have a full approval, the FDA process of what they've got to go through to get a full approval, I would hope that that takes place within the coming month. I can't get ahead of the FDA. I can't predict what they're going to do, but I hope that as we get into August, that they do get a full approval. And with that, you'll see a lot more enthusiasm among some of the recalcitrant people about getting vaccinated.
Let's talk about masks. As you know, children are preparing to go back to school. The CDC reportedly will be recommending guidance for everyone in K through 12 schools to wear masks. That includes teachers, staff, and the children, regardless of vaccination status. Why has this become so politicized, and what would be your recommendation about mask mandates?
Well, I really should not be politicized. We're dealing with a public health issue. I've said that so many, many times. over the last literally year and a half, that this is a public health issue that needs to be dealt with in the context of the public health and not make it a political issue. We're dealing right now with an evolving situation because we have the Delta variant that was not dominant 2 months ago, for example. It was mostly the Alpha variant. This Delta variant is a really bad actor. It transmits much more readily between person to person. And for that reason, you're seeing that the recommendations are that when you have children in school, the children who are young and unvaccinated, and even some of the vaccinated ones now, that are going to need to wear masks. And the reason for that is you want to make sure that you protect the children so that they can safely go to school in person. That's the main goal. As we get into the fall, we want to have a full in-person curriculum for the kids so that they don't have a situation where the schools are not open or they're doing virtual learning. We want in-person learning for the children. And the safest way to do that in the context of a variant that transmits very readily is to have the children wear masks.
Dr. Anthony Fauci right there. We'd like you to stay with us on The World Tonight because coming up next hour, we'll have more with Dr. Fauci. I'll ask him about the problems in Black and brown communities dealing with vaccine hesitancy. We'll also talk about the misinformation and the politicians who keep challenging the science.
And now to new guidance from the CDC on when and where to wear a mask. Reversing course, the CDC is now recommending that even vaccinated people return to wearing masks indoors in parts of the United States where the coronavirus is surging, citing new information about the ability of the Delta variant to spread among vaccinated people. The CDC also recommends indoor masks for all teachers, staff, students, and visitors to schools, regardless of vaccination status.
Dr. Anthony Fauci is concerned about the Delta variant and the impact the coronavirus is having on the unvaccinated. Earlier today, we discussed how Americans cannot afford to go without getting vaccinated. The consequences are just too risky. Dr. Fauci, to the Black and brown community, what would be your message about getting the vaccines, about wearing the mask? Because, again, there's still vaccine hesitancy out there, albeit for historical reasons, but also due to the fact that the FDA has not given full approval as well. So there's any reason for people resisting to get vaccinated. It seems to be something that they capitalize on. But what would be your message to Black and brown communities as well as rural communities about the importance of getting vaccinated?
Well, I mean, obviously, everyone needs to articulate why. You look at the numbers speak for themselves. If you take a look at the deaths due to COVID-19, 99.5% of the deaths are among unvaccinated people. Only 0.5% of the deaths are among vaccinated people. So the unvaccinated people are at the ones that are at risk. However, having said that, what we need to do and are doing is to have outreach into the brown and Black communities to get trusted messengers to interact, relate to, and convince people why it's so important for your own safety, for the life of your family and the safety of your family, and for the community. Because when you get vaccinated, you not only protect your own health, because even if you were unvaccinated and had an infection and you were a young, healthy person who did not have any symptoms, it is still conceivable, if not likely, that you will transmit the infection to someone else who may not be so healthy and may, in fact, have a vulnerability of getting a severe outcome from infection. So it's not only about yourself, which is very important, it's about your family and your responsibility to your community.
Dr. Fauci, the president has stated that, and you have stated as well, this is a pandemic of the unvaccinated. You just sent a very clear message to black and brown communities. As you know, the president has released, or at least the Biden administration is sending $100 million to rural communities throughout the country. That is very important to get to stop the misinformation going on in those areas. Again, rural communities, black and brown communities, the states that you've mentioned where there's still a large number of unvaccinated. Does it frustrate you that there's still so much misinformation going on social media, as well as even from some members on Capitol Hill, people that you've had to really face on hearings at the Senate? I won't get into who, but you know who I'm talking about, and you've had to deal with that over and over again when people are challenging you on the science. Does it frustrate you to no end to know that there's this information that's still going on?
Yeah, that is quite unfortunate. You know, misinformation in and of itself is a bad thing, but when misinformation leads to illness and death in people, that makes it a really bad thing. So the best way to counter misinformation is to provide a lot of correct information. And that's what we're trying to do. Yes, of course, it's frustrating when you're trying to implement a public health program and get across a public health message that you have people by their actions or their words who make that much more difficult to do. That is quite unfortunate because in many respects that's losing lives by doing that.
We are seeing that some Republicans, I know you have to go soon, but we are seeing that some Republicans are now stating to their constituents, get vaccinated, wear a mask. There's still some hesitancy among some state legislatures or governors to impose any mandates. Do you see any hope or any light at the end of the tunnel in this long war that we've had, this protracted war that we've had against COVID-19? Because some people, let's face it, have been losing hope when they see the Delta variant becoming more contagious, more transmissible, and there's also the Lambda variant that's out there as well.
Well, I'm fundamentally a cautious optimist, and I am optimistic. I like what I've seen recently, where Republican leaders such as Steve Scalise, such as Governor DeSantis of Florida, who have both come out and said it's important to get vaccinated. I think if we get more leaders like Steve Scalise, like Governor DeSantis, and Asa Hutchinson from Arkansas, who are really out there beating the bushes to get people vaccinated, I think that's a very important signal.
Dr. Fauci, I want to thank you for joining us today. I know how busy your time is, and we appreciate you stopping by to talk to us about the importance of getting vaccinated as well as wearing masks. And final question, have states opened up too quickly, and because of the Delta variant, should they be now considering a lockdown, or do you think they'll be able to avoid that if people will do the right thing and wear masks and get vaccinated?
Well, that's a very good question. I do not see a lockdown in the cards right now. I think we can handle this if more people get vaccinated. For those who are not vaccinated, mask up, and in certain circumstances, just go the extra mile to be really careful. I do believe we do not need to lock down given the circumstances that we have today.
Once again, I want to thank you for spending time with us here on the Black News Channel of the World Tonight. Dr. Anthony Fauci, thank you so much, sir.